Well, hello and welcome back to another webinar here at the Bellevue Chamber. Appreciate you all joining us. This is actually our seventh webcast in the last couple of weeks since we've been stuck at home and enjoying ourselves over video. And we've touched on a whole host of issues, from an economic forecast to how we're dealing with applying for benefits from the federal government, to some of the work that our nonprofits are doing. It's been a great opportunity to ask questions, to listen to folks in the community, and to have some of the leading experts on so many of these important issues join us and talk to us one-on-one, and more importantly, to answer your questions. So as another reminder, please make sure that you make use of the Q&A button at the bottom of your screen, and use the chat function as well, and send your questions to us. We're very interested in getting to those throughout the course of the hour. If for whatever reason we're not able to get to those, our great panelists here today have offered to respond and do a little research along with the Bellevue Chamber staff on some of the specific questions that you might have pertaining to today's topic. And of course, today's topic is very important. We know that there have been exponentially large numbers of unemployment benefits being applied for over the last couple of weeks. We know that businesses are struggling to identify what kind of programs and what kind of ways they can support their own staff. But there's also a great deal of uncertainty, a great deal of question about what's the right way to go about doing these things: furloughs, benefits, the continuation of some of these contractual obligations, and some of these issues with regards to liability for having a workforce that's working from home. A whole host of questions, an hour to deal with it, and three phenomenal panelists that are going to help us do that. And so I'd like to take a quick moment to introduce them right now, and then we'll kick it to them to get started. Our first speaker today is Michelle Bomberger. She's the CEO and managing attorney at Equinox Business Law Group. Michelle's background and experience as a businesswoman, entrepreneur, and business lawyer enable her to talk with clients about their needs across their organization and craft alternatives and solutions that make sense for that particular business in light of its goals. Morgan Matz, who is account executive with Parker Smith and Feek, who specializes in employee benefits department. She helps clients strategize and build and execute their employee benefits program. She believes employee education and health promotion, along with incorporating an employer's culture and mission, are key factors when developing a long-term business strategy with her clients. And finally, Marie Gallanar is vice president and account executive at Parker Smith and Feek. Her consultative approach to understanding her client's business as a whole helps her assess their current and potential risks. Her background in financial services helps her understand how a client's exposure affects the bottom line. These are three great speakers that have a wonderful presentation for us and are ready to answer our questions and help all of our viewers understand how to react in these changing times. So I'm going to kick it off to Morgan. Welcome, and thanks for being here. And hopefully Morgan's not on mute.
Hey there, can you hear me now? Sorry about that.
Yes, there you are.
Thanks, Joe. Really appreciate you having us here today on behalf of Michelle, Marie, and myself. Super excited to get in front of the chamber today. Before we really jump into the presentation here, I wanted to first acknowledge that obviously the coronavirus outbreak has really affected us all in several ways, right? COVID-19, it hit hard, it hit quick, and it hit from all angles. So we recognize that people are dealing with the actual illness itself, right? Clinical implications, the burden on the healthcare system, reeling with the impact it's already had on our local global economy. Almost all of us are settling into the new norm of having our house not only be our place of refuge, but it's now our office and schoolroom. And on top of that, right, trying to keep up with and understand all the complex regulations that continue to be rolled out in phases. So it's a lot. When we recognize the content that we'll be covering today is just simply one piece of the kind of COVID-19 pie that you're dealing with. We know the impact is much more far-reaching than just HR benefits and employer liability. But on that note, we know there's a whole lot of questions and important things to consider from an employer's perspective during this time. So our goal here is really to help address some of those topics, hopefully bring some solutions, ideas, and simply just clarity to the forefront. All right, so the economic damage of the coronavirus pandemic, it continues to worsen as stay-at-home orders have made more non-essential businesses shut their doors. There's no question these disruptions have had a huge effect on the workforce, with many businesses lacking the financial resources to really keep workers on the payroll without revenue coming in. So this slide here just speaks to some of the current statistics on unemployment and the number of uninsured. And as you can see, it's staggering, right? I'm sure many of you have seen or have heard, but a record 6.65 million people filed for unemployment kind of that last week of March. And we know with the federal government opening up unemployment coverage to self-employed workers that the jobless claims will just continue to rise in the weeks to come. An interesting projection that I had pulled from the Health Management Association predicts that anywhere from 12 to 35 million people could lose their jobs and furthermore their employer-sponsored coverage. We can also expect a spike in Medicaid enrollment, anywhere from 10 to 20 more million people. The same study shows that the total uninsured number can increase to 40 million people. So these numbers are daunting, right? This really reveals the significant and really fragile connection between employment and health insurance. And we know that almost every employer right now, in some shape or form, is affected by the pandemic and the economic downturn. So before I hand the reins over to Michelle to talk more on paid leaves and workforce reductions, I think we're going to take our quick poll here if we're able to get the technology up and running. Awesome. So this is a really simple question here. We just like to better reveal kind of our audience and for those of you to understand your fellow members here. Have you been deemed an essential or non-essential business? It's a pretty quick one. We'll ask that you fill that out. While you're submitting your questions, I'm going to go ahead and lead it off to Michelle on employee leave options.
Great, thanks Morgan. Thanks Joe and the Bellevue Chamber for having us today. So on the leave options point, we're used to addressing employee leave questions. We have, sick leave and we have PTO. These are things that are kind of par for the course in what we deal with every day as employers. But many of you have probably seen over the last few weeks completely new questions that come from employees around this particular illness, around fear of coming to work, fear of being exposed, indirect exposure. So I had lunch with a friend who it turns out her mother-in-law had it. These fears come at us from very different angles than what we've seen in the past. In addition to that, we've got school closures, we've got quarantine, all of these add to the mix. And the state and federal governments have implemented some changes to the systems and infrastructure in order to try to help support businesses and individual employees with additional benefits. So we're going to walk through the different leave options that are available. Some of them will be very familiar to you and some of them are newer, but we'll try to go through them pretty quickly. And again, happy to answer questions after the program. So we'll start with paid sick leave. This is something that's been around in Washington for quite a number of years. Many states have implemented it, but not all states, which is a part of why the federal government began to step in. In Washington, we have the mandated sick and safe leave. City of Seattle has a similar policy. City of Tacoma has a similar policy. And this has been expanded a bit to go beyond just individual illness and care for an ill family member to also cover quarantine, school closures, or an employer closure due to a government order. So some of this will factor into how your own policies are created and crafted. So if you require a doctor's note for certain types of claims, you'll want to look at how that's crafted within your own policies. The law requires certain steps and provides for the option for other steps. So again, you'll want to look and see how that works within your own policy and determine how to apply it in this case. Similarly, most of you are probably familiar with the Washington State Paid Family and Medical Leave, what's called PMFL, that took effect on January the 1st of this year. You've been paying premiums into it for a year prior to that. And that was kind of an extension of what the Federal Family Leave Act, the FMLA, provides. But for Washington State, it provides partial wages to cover a longer term illness. In Washington, that's 12 weeks. But it was limited to illness, and it still is. It was already oversubscribed between January 1st and when COVID-19 started to take effect. And so, as you can imagine, there are many, many more people who are being under this program, and Security and Ellen and I are really working to try to keep up with the volumes within both the paid leave as well as the unemployment sector. So things are taking a lot longer, but this is available for folks who are ill or have members who are ill. So in addition to the programs that we have had in place in Washington, the FFCRA, Families First Coronavirus Response Act, was passed by Congress on March the 18th and became effective April the 1st. You've probably seen a bunch of information on this. It was a big deal because it expanded leave benefits to workers. It applies to private businesses with 500 and fewer employees and issues related to COVID-19 claims. One of the big questions was, how do we pay for this? Because the employer runs this through as if it is a regular sick leave on their payroll, and then they can obtain payroll deductions and tax credits to pay for it. So the cash flow issue has been a really significant part of how employers can help their employees to take advantage of it, because it is money out the door that is reimbursed later. So when we look at what it covers, the federal emergency sick leave is very similar to the sick leave we have, and is in addition to the sick leave that we have here in Washington. So it's 80 hours that an employee can take that comes into effect if they are unable to work due to one of these categories: government quarantine or isolation, a healthcare provider recommends quarantine, they're ill and they're waiting for diagnosis, or they have to care for a family member subject to quarantine, school closure. So then the question becomes, well, what does unable to work mean? And it's work or telework. So they do include the ability to work from home. But this really comes into a question when an employer is maybe an essential employer, so they are open, but the employees are subject to the isolation order. So the poll showed that 64% of folks on the call are essential employers. Well, so what does that mean from the employee's right to take this leave? And there's not a clear answer to that one at this point. The governor has tried to create some clarity around must versus may, but it's not something that is clear cut. Similarly, in addition to the sick leave, the FFCRA Act implemented an expansion of what's typically FMLA. FMLA typically applies to family leave and is typically unpaid. And what they did was they expanded this specifically to cover 12 weeks of leave to care for children due to a school-related closure. As we know, so many employees are struggling to balance the kids being at home and having to work and having to telework in a similar fashion. And the standard of you are unable to work or telework due to this claim is the standard behind when this would apply to your employees. So again, going back to what does it mean to be unable to work? It's when your employer has work for you, but you can't do it because of one of these COVID-19 related matters. So it's a complex sort of web of different kinds of leaves that are available. The employees are entitled to take these federal leave options in addition to and before what they have available through the employer as well. So understanding how all of your different policies play together is really critical here. I'm going to quickly go through a couple of other items. Vacation and PTO, obviously, your employees have what they have accrued and can use that in addition to the sick leave and the family leave that's available. And then a lot of companies have unpaid leave of absence. So something that's come up a lot are folks who are afraid to go to work. And in being afraid to go to work, there's no coverage through paid sick leave or paid family leave. PTO and leave of absences are sort of the areas that really can support them. And we do really recommend that as an employer, you be flexible, that you really try to think about how best to support your team when these questions come up, because this is not, as Morgan mentioned, a one slice of the mind issue. This is hitting people from so many different angles, and so that patience and empathy is an important part of the conversation. So let's look at poll number 2. So poll number 2 addresses, have you had to lay off or furlough any portion of your workforce thus far?
Great, thanks, Michelle. And while everyone's submitting their answers here, this is kind of a great segue to talk about workforce reduction options.
Yeah, so, similar to the leave questions that we've had, businesses are faced with kind of impossible decisions right now around the uncertainty of this environment. Businesses that are completely closed, or they've just had a substantial decrease in their workload because customers aren't available, or they've been closed for non-essential reasons. Sometimes their employees can telecommute, sometimes they can't. And so they're really forced to look at workforce reduction options. So we thought we would tackle a couple of the different ways you can look at workforce reduction, because the state has also expanded those rights available to employees. And the federal CARES Act, which passed, it seems like a couple weeks ago, but it's probably only a few days ago, the CARES Act expanded unemployment options for self-employed individuals as well, which is a completely new category. So again, government stepping in to really try to offer some relief for both businesses and individuals in these difficult situations. So a layoff, true layoff, the intent is not to rehire that individual. I just comment here that when you lay somebody off, consider what other policies or benefits play in, because a temporary workforce reduction and a layoff may have different impacts. If your policy says that you pay out PTO upon termination, well, that may be the case here. Morgan will be talking about health benefits and how that would play into either a layoff or a temporary workforce reduction. So be cognizant of how these decisions impact other areas of your benefits and your workforce. So temporary workforce reduction alternatives, there's quite a few out there. Go over them pretty quickly here. So standby is really an intent to bring that person back on. It's been expanded to cover both part-time and full-time workers, and it's 12 weeks with no requirement that they seek alternative employment during that period. They must have a proposed return to work date, and that's something you as the employer will fill out as standby on the form that you receive after they've submitted for unemployment. You have a furlough, which is a temporary layoff. Could be a complete stoppage of work or just a reduction in hours. There's a lot of employees that even with a small reduction of hours wouldn't qualify for unemployment because their compensation is too high. So it just depends a bit on how those factors play out as to whether a furlough will entitle them to unemployment insurance. Partial employment is a reduction, similar to furlough, a reduction in the number of hours that the employee works. They have no obligation to seek alternative employment, but they must work at least 16 hours a week in order to qualify for that benefit. And then the shared work program is actually an employer-led program. So this is something that you as the employer would go to Employment Security and set up. It's been pretty successful in assisting with filling the wages for an employee who's had some reduction in their work hours. So it gives you some flexibility in who's participating, the number of hours that they are working, and then allowing for unemployment to sort of buffer the two. So that's something to look at if you're kind of trying to spread this over a workforce. And then I wanted to just briefly mention, a lot of companies are just working within their teams to address a kind of a comprehensive across the board wage reduction. For many employees, that's a better option than unemployment. And it's a way that employers can keep folks employed, sometimes with a, an intended bonus to make that up later, sometimes not. There's a conversation that needs to be had around that, but it is an alternative to think about with respect to keeping people employed during this period.
Great, thanks, Michelle. Just monitoring some of the questions coming through. Just quick question for you. Do you have to have an intent to rehire for a furlough? I know typically that's needed for, standby, but is that necessary for furlough?
With a furlough, it's more often a reduction in hours. And so the person is still employed at least to some degree. The standby requires an actual return to work date, whereas a furlough, I don't know for certain whether that's required. We can look that up though.
Yeah. All right, thanks, Michelle. So great information about all the different leave options available to employees, and also working through the workforce reduction. And I'm now going to really jump in kind of how these different scenarios impact or affect benefit coverage. So when putting together this section, there's so much to cover, but I wanted to definitely spend some time talking through furlough versus a layoff, and when one might be more appropriate over the other in respects to kind of the benefits coverage and extension of benefits. I'm going to quickly then talk just about COBRA. I know COBRA is coming up as kind of the bottom line option in many of these kind of workforce reduction scenarios. There's definitely some unforeseen consequences that I've seen in the way that employers are currently handling COBRA. So I'll go over that quickly. I'll also touch on the permitted cafeteria plan election changes. Basically what that means is when the IRS will allow employees to really come off or come on to a group sponsored plan. There are actual specific rules around when that is allowable. Quickly touch on the public exchange, the Washington State Exchange and subsidy eligibility. I think that's a really important piece to the puzzle, and some employers don't quite realize how their handling of different, be it a furlough or layoff, how that affects the employee's benefit, the employee's eligibility in the marketplace. And then lastly, this has been the $1 million question. I know I've been fielding it for the past several weeks, and that comes down to benefit continuation, right? Can I keep employees on the plans? Do I have to drop them? And kind of what are the allowances there? All right, so the first section here we'll talk through is furlough. As Michelle has already shared, and for purposes of discussing, benefit implications, it's important that we understand when you furlough an employee, they're remaining employed. So they may have reduced hours or even been placed on a temporary leave of absence, but they are still on payroll and still deemed an employee of the organization. So because of this, there are some potential, flexibilities and consequences when it comes to extension of benefits in a furlough situation. So the initial and kind of easy answer when it comes to benefits is that if employees no longer meet the plan eligibility rules as stated in their benefit contracts, and that's typically right, they have to be active, working full-time, coverage should be terminated, and then COBRA would be offered. Typically, the employer coverage will last until the end of the month in which that furlough has taken place, COBRA would then start first of the month. So that's kind of the bottom line and the most conservative response. However, there are several caveats to that. The first is if you are an employer that uses the look back measurement method, and if you are unsure what that is, then you most likely are not using that method. But basically, you're taking a time in the past to determine employees' full-time status. Typically, we see employers that have high seasonality or variable hour workforce are using that look back measurement method. But in using this, employees actually remain eligible for benefits for the duration of their stability period in which they're in. Basically, they have earned coverage for the full stability period. And that's going to include the time on furlough. So as long as that employee is still employed and they've been deemed a full-time employee per their look back period, they actually need to remain on benefits throughout the stability period. So even if they are experiencing a reduction in hours, unless the employment is terminated. So again, in a furlough situation where the employee is still employed and on payroll, they're going to have to remain on benefits. So that's been a big gotcha for lots of employers that I've been working with. If you are an employer that's using the more standard kind of monthly measurement method, assessing hours, on a monthly basis, employees are just unlikely to meet the plan eligibility requirements during, the period of reduced hours. So during the furlough, there is no stability requirement, what have you. So that's going to follow your typical loss of eligibility. Coverage is then rescinded and then COBRA should be offered. Another consideration, and one I know Michelle touched on, is if an employer has a leave of absence policy for, a specified circumstance, which would then extend benefit eligibility for a period of time. I know many employers have, something special like this that's laid out in their handbook. So if an employer already has something like this in place, you'll definitely want to assess, whether the short-term furlough will fall under this leave of absence policy. If you do not have something in place, and I know I also have employers that don't have anything in place but are interested in possibly, adopting such a policy, the safest approach would definitely be to make sure that leave of absence, the special policy is available to all similar situated individuals, and that you are carefully coordinating that with the carriers, or if you're self-insured, with the stop loss vendors. And that's just really to ensure that claims coverage during that leave of absence is covered, right? And there's no liability that's back on you, the employer, for any, high claims. So something I also want to note is if you're an employer using that look back measurement method, as I mentioned, or you have a leave of absence policy in which benefits are extended, you'll definitely need to determine a method of collecting the employee contributions. So that's kind of taking it a step further. If you're doing a furlough, reduction of hours, you want to extend benefits, how are you going to handle the employee's contribution, right? Their monthly portion. And I get this question a lot, and I usually have two suggestions. The first would be require employees to pay in after tax during the time they're out, or during the time, I should say, of the reduced hours. Or alternatively, you, the employer, could cover the cost and then allow employees to make pre-tax catch-up contributions upon their return to work. I definitely recommend, though, that you adjust the premium contributions in the same fashion for all, and definitely want to carefully communicate to employee their responsibility and timeframes. So the other situation is a layoff, right? A layoff is a lot more straightforward than a furlough scenario. So a layoff is truly considered a termination of employment, although it can be potentially short-term under these circumstances. So for employers having to make the tough decision to entirely lay off employees, that's going to follow your typical termination protocol, right? Coverage will extend typically through the end of the month, and with the layoff occurs, then that constitutes a COBRA offer. Something to be mindful of with a layoff is whether you have any specified kind of termination policies or payouts that are stated in your handbook. You want to notify the employees also, as soon as you're aware that the layoff is coming. Obviously, given this time, that's not always an option, but definitely trying to get out in front of that as soon as you can. In either the furlough or layoff circumstance, Something important to note, the employees will not qualify for that paid sick leave or expanded FMLA. I know Michelle touched on those two new paid leaves under the Family First Corona Response Act. All right, so how does COBRA play into this? In both scenarios we talked through, right, the common kind of most conservative answer is if they're not meeting eligibility, benefits is terminated, offered COBRA, though we did talk about some exceptions. But as many of you know, COBRA can be super expensive, right? As the employee is going to take on that total monthly cost or the total premium with an added 2%. So lots of times, and what I've been running into a lot with some of my clients is there is a desire from the employer to subsidize the COBRA premiums for a period of time, right, for the employees. And an employer could absolutely do so, but it's a big but. In paying for all or some of the COBRA coverage for a portion of time, employers are actually inadvertently locking individuals into a situation where their only coverage option will be to continue COBRA. And then on top of that, these former employees will have lost their special enrollment window or opportunity to enroll in a potentially less expensive insurance option, let's say like through their spouse's plan or the exchange. So I recognize that employers, right, you're trying to do the right thing and take care of your people, but it's vital to understand that, if you are not rehiring or you end up ultimately not bringing these employees back, and then therefore you stop paying a portion or subsidizing the COBRA premiums on their behalf, this is not going to be a time then for them to turn around and go on to the exchange. So if you are unsure, even a little bit, about the possibility of rehiring or bringing back an employee, they're going to definitely be better off deciding to elect COBRA on their own or perhaps look at the exchange. And most likely with, any reduction in income or, hours reduced, they're going to have a premium tax credit or potentially even be eligible for Medicaid. So just some things to think about there in terms of COBRA. All right, what about cafeteria plan election changes? What that really means, a cafeteria plan is basically a benefit plan that allows pre-tax payroll deductions to pay for coverage. So when employers, allow the use of pre-tax payroll deductions, when an employee basically makes their benefit elections, it is technically binding for the full plan year. And these are rules set by the IRS. And they're binding except for certain occasions. And we call these kind of qualifying life events that allow employees to make mid-year election changes or if they wanted to drop coverage altogether. And this is pursuant to Section 125 of the IRS. So what that means to you, as an employer, you actually need to be pretty careful whether you're allowing employees to just simply come off the plan haphazardly. A termination or a loss of benefit eligibility that would clearly permit a mid-year change or drop in coverage. In addition, let's say a change in the cost of coverage that's initiated by the employer, that's also going to permit a corresponding change. But on the other hand, and a question, and I think the point of confusion is that what about a reduction in pay and whether that is a qualifying life event? And technically the answer is no. So, if benefit eligibility hasn't changed, so if the employee is still working and they're eligible for benefits and the cost to them hasn't changed, and let's say they've experienced a reduction in pay, that's not going to technically, per the IRS, be an allowable time for them to just simply drop the plan. This is always a time where I like to take a step back and kind of take off my consulting hat. And I would say, think big picture. We know that these are unprecedented times and employers want to do everything in their power to help their employees. So with that being the case, if you or if an employer chooses to be a little bit more flexible under these unique circumstances by, let's say, allowing an election change or an employee to drop off the plan, it's not specifically allowed under Section 125 rules. It seems extremely unlikely that the IRS would actually take any enforcement action. Now I'm gonna caveat and say in no way, shape, or form am I providing any legal guidance here. I know Michelle is probably shaking her head, but I think sometimes we can get bogged down in those rules. So just something to think about. Technically there are some IRS rules when it comes to coming on and off the plan. All right, the exchange and subsidy eligibility here. Washington State was among other states who had decided to open up kind of these limited special enrollment window on the state's exchange in response to COVID-19. The window closed as of yesterday. I'm sure you guys all saw that opened up several weeks back and closed yesterday. And it was really intended for individuals who were already uninsured to obtain health coverage in the times of the COVID outbreak. But something to note, even though this window has closed, if an employee or one of your employees loses coverage involuntarily, so again, that's going to be either through a furlough or a layoff, this would constitute a qualifying life event and an opportunity for the employee to then, go on the exchange and shop for coverage that way. Typically, they have about 30 days to enroll from the actual qualifying life event. As I mentioned earlier, many individuals are going to probably be eligible for Apple Health, which is Washington State's Medicaid program. So I would strongly encourage, employers to remind former employees at this point their rights, right? And remind them, I know this is a scary time, and unfortunately, right, benefits are not going to extend if that's the situation you're in. Remind them to go onto the exchange and shop for coverage, especially because, right, they've had a loss of income, right? They're most likely going to be receiving a pretty hefty tax credit, if not, completely free through Medicaid. All right, on to kind of my last section here, and this is the really million-dollar question, is benefit continuation. And unfortunately, there is not one shiny, easy answer to give you here. It really depends. It depends on lots of things. But what I would first ask you or ask the employer is really, what is the intent? Is the goal to allow continuation of coverage for your employees, even with a mass reduction of hours? Or is there a need to cut costs, right? Are you looking to circumvent a situation in which you would be responsible to have to give benefits? Going back to kind of that furlough versus layoff. So what I would say is that many of the local health insurers here in Washington have really stepped up to the plate and have announced that kind of these blanket statements that are putting the onus back on the employer, saying, as long as we are getting paid, we're going to give you this allowance, this extension or grace period to allow employees to stay on the health plans through a certain amount of time, regardless of what their hours do. And for most employers that I have seen, that date has been May 31st. So if you are questioning that, or you're not sure kind of where your current specific carriers or insurers, or TPAs, if you're self-insured, what they're allowing, I would definitely, circle back with your employee benefits broker and see what's available to you. Again, most have been allowing that. At which point, once May 31st or June 1st hits, we'll have to see if they're reassessing that. But they are really stepping up to the plate and allowing that flexibility. So definitely something to be aware of. The carriers have also been great in that they are extending their kind of premium payment grace period. Almost all of the carriers that I've worked with, instead of a 30-day grace period, they've actually doubled that, allowing 60 days for payments to come through. And they've also implemented these rehire rules. So if you do have to furlough or lay off employees, and you in turn, hopefully, luckily, rehire a lot of these employees back, if within 6 months, they'll actually waive that waiting period. So they'll be able to come back onto the plan first of the month following that rehire. So unfortunately, as I mentioned, there's no secret, right? There's no one answer for all, but I do know that many of the health insurers are stepping up and basically allowing an extension or continuation of benefits at least through May 31st. Okay, that was probably way too much.
Good afternoon, everyone. Let's talk about concerns in the workplace and how we should be thinking about various business risks and employee risks at this time. You're just going to have to imagine my slide here because we're having technical difficulties, but I'm going to keep talking. So we just did a whole webinar, Parker Smith and Feek did, on how to handle a confirmed or suspected case of COVID-19 in your facility. So I won't go into details here, but I will refer you to the CDC and EEOC websites for resources on how to disinfect your facility and the questions you can and can't ask employees around the virus. Just a note here on workers' comp claims. Originally, we thought that claims for employees contracting COVID at their workplace would be declined, but we are now submitting these claims if employees are working in close quarters and there has been a confirmed case of COVID at the business. Just a side note, there's also a family that is suing Walmart after an employee died from COVID-19, and the family believes that Walmart did not do enough to protect the individual. Be sure you are referring to the CDC's guidelines for sanitation and required PPE for your industry if you are an essential business. And it sounds like 64% of the people on the call today are. That's still operational and that you are communicating these guidelines to your employees. This type of lawsuit, the Walmart lawsuit I'm referring to, could trigger a coverage that's rarely used, and it's called Washington stopgap insurance. And it's only in monopolistic states like ours where the workers' comp is run by the state. So one thing to be mindful of is you're going to want to check with your broker to be sure that you have this coverage in place. And if you're operating in Washington, which I'm assuming all of you are. Potential employment practices claims. A couple things to keep in mind. Keep up with those quarterly and annual reviews. If you need to terminate someone down the road, you'll need this documentation. Also think about what your policies will be around production during this time of distraction. Michelle's going to talk more about this in a moment, but just a reminder that it's really important to be consistent. Updating your policies and procedures and making sure that you're sharing those new policies around safety and working remote with your employees. There's a lot of recommendations from the carriers about, peeking in on your employees via Zoom meeting and asking them to kind of show you around their office to make sure that it's safe and that they're using surge protectors and they don't have cords all over the place. Asking employees to designate a certain room in the house to minimize the likelihood that they could make a workers' comp claim if they are tripping and falling on their way to get coffee from their kitchen. However, the stuff can still happen and it can still turn into a workers' comp claim. So just be mindful. And obviously we're in kind of a unique situation right now. You have a lot of employees who weren't designated as folks that would normally work from home. So just be mindful of trying to implement as many of those policies as are practical during this time. Another thing to be mindful of is those Zoom meetings that we're all been having. There's been a lot of information on the news about hacked Zoom meetings. Be sure to use a PIN and also be thinking about how you're allowing your employees to use Zoom meetings. If you're allowing them to use for happy hours or, hey, it's your mother-in-law's birthday, go ahead and use the business Zoom account. But if one of those recorded meetings that's maybe not so flattering ends up on the internet and goes viral, you could have a potential employment practices claim on your hands. Case in point, for those of you who have watched the Poor Jennifer video that's gone viral on the internet, that could turn into something that you would rather not deal with down the road. Also, employees borrowing equipment to use at home. If you've allowed employees to take substantial computer, maybe some other office equipment home, you may want to consider requiring that they insure that equipment on their renter's insurance policy or their homeowner's insurance policy. It is likely not covered on your business insurance policy, but you want to check with your broker. Also, material change in business operations. We've seen a number of manufacturers stepping up in our community to produce ventilators and other PPE. One thing they will want to make sure to do is check with their broker to discuss whether or not this new venture is a material change in operations. If you were an HVAC manufacturer and now you're making ventilators, then that product liability may be excluded on your policy. You could also risk being non-renewed by your carrier because the new venture doesn't fit into the carrier's appetite or capability. So just something to be mindful of as we're all moving fast and being nimble in this current environment. Also, we've seen an increase in cyber and crime activity in just the past few weeks. A lot of that is related to people using not so secure networks, maybe not using their VPN to log into the company's network or saving things on their personal devices. Bear in mind that most cyber policies do not cover what is known as social engineering, which is when a fraudster tricks an employee or a business owner into sending money to the fraudster instead of maybe to a vendor. And so just check into your policies and make sure that you are not unintentionally self-insuring these things. Now on the next slide, we're going to just take a quick look at ergonomics for those that are working remotely that maybe have not worked remotely before, we can also attach another version of this slide that you can send out to your employees that talks about how to set up ergonomically while you're at home. We obviously understand that most people are not going to have a fancy chair and maybe a tray for their keyboard, but some things they can do is just making sure that if they're using their laptop, that they try to keep it in their lap. They're trying to achieve this kind of 90-degree sitting position. If they don't have good lumbar support, they can use a hand towel rolled up and put behind their back. They can use a footrest, which could just be like a box for shorter individuals who don't have an adjustable chair. And then just reminding people to take frequent breaks, especially if their setup is not great for ergonomics, because you gotta, this is longer than we all thought it was going to be. And so for those employees that are susceptible, you just wanna make sure that you're reaching out and reminding people to take care of themselves during this time. Thank you.
Great, thanks, Marie. And for those, I know that we may have kind of a please move this window. I'm not sure if you guys can see that flashing in the middle of the screen. We're working through that, so apologies if you are seeing that interruption in the middle there. But on to poll question number 3. And this is a great segue where I'll pass it on to Michelle, is if you currently are basically asking you, do you have a work from home policy currently in place? And has it been distributed? And with that, while everyone's submitting their answers, I'll pass it on to you, Michelle, to talk through remote work policies.
Thank you. So Marie just mentioned a number of things that probably get you, your brain thinking about, do I have this covered? How is this working in my current business as I've shifted folks to working from home? And, many companies have been forced to look at the remote work policies as a temporary thing. Grab the stuff you need, set up something at home, do what you need to do, and just make it work. But as we kind of look at this lasting longer than maybe we originally expected, or maybe we decide that this is something we want to continue. And for some of you, you've maybe already been doing this for quite a while anyway, due to either the nature of your business or your employees' wishes. If you don't have a formal policy in place, you really kind of set up a situation where there's no clear expectations. And so the real purpose of having that policy is that everybody's on the same page and knows what to do and what to expect. It's going to really protect both your business and your employees from some of the risks that Marie just mentioned. So do we have the results of that poll number 3 yet? I'll wait for that to come up here as I continue on. So I think the first thing to think about is the who and when of the work from home policies. So, in this case, we kind of have an everybody who can approach, but from a more big picture, longer term perspective, who is authorized to work from home and when? Is it a flexible work policy? Is it a permanent, you get to work at home all the time? What do those pieces look like for your particular business? And so once that's determined, you can then get a gauge for what requirements you need. One of the most important things is work hours and time tracking. So especially for employees who are non-exempt, it's really important to make sure that the expectations around work hours are set, the expectations around overtime are set, and PTO are set. So folks know, and how they're tracking that time, how they're managing their time, and there's not surprises around, oh, I'm taking the dog for a walk, or I'm going to pick up the kids. Those things are a part of the plan. So setting those rules and expectations will really get everybody on board to move forward together. Similar to that is participation and collaboration expectations. So if you've historically done a quarterly performance review or a monthly one-on-one, what does that look like now? If someone had specific success factors and expectations for their workplace and their deliverables. Well, what does that look like now? So there will be a shift. And as you meet with your employees and talk about this different model for working, be sure those expectations are set as much as the hours and time tracking components. Workspace, this is a moving target. You know, right now, as I mentioned, a lot of folks, it's very much ad hoc. But as this becomes more permanent, what are your expectations? And this should be what's in your documents. Your documents should reflect, you need a place that's dedicated for your work. You need internet access, presumably, maybe not in all cases. If you're on the phone with customers, is it okay to have, you know, pets and kids and, you know, phones ringing and doorbells ringing? What are those expectations about what that workplace looks like? And I know that I've seen just in the last few weeks a complete shift in what the expectations were, you know, end of 2019 to, you know, March of 2020. There's a sort of common humanity that we're seeing with everybody working from home and the distractions and the personalities that we share. So you'll need to decide within your own work environment what is okay and what is not in the long run. The safe and healthy work environment, you know, this is an obligation of all employers. Many of you think of this from an OSHA standpoint. Marie mentioned the ergonomics component. So ensuring that you set expectations again around what does this mean when you're working from home. Marie mentioned the workers' comp component. You know, what is the workplace if you're at home versus the home place at home? Creating, again, those boundaries so that you can call that out if you need to, that they fell down in the kitchen versus falling down in their office. It will help you to be able to make a claim or object to a claim if you need to, and just set those clear standards for your employees. Also remember that employees who do have ADA accommodation requests, whether pre-existing or new ones, as an employer, you do have an obligation to work interactively with them and get them the necessary tools that they need, assuming that that's not a hardship for you. And then I think one of the big ones is tools provided. You know, for some companies, they've already got everything available via the web. Everybody's got laptops. And for some, we're really trying to fill in the gaps on how do I get, you know, secure access to our servers. We've never had to do that before. So there are two components to the tools. One is what systems are needed, and how can we roll out those systems and provide the necessary training so people can use them? Because that's a big part of, not everybody's sitting together where we can do training the way we used to. How do we ensure people are able to use the tools? And then secondarily, what tools, what physical tools are required? And are they using company tools or are they using personal tools? You all may have heard of a kind of bring your own device policy. And this has been pretty common with folks who have their personal mobile phone that they download work emails to, right? So now we've got work content being on a personal device. What requirements do we have if you're using your personal device? Nowadays, we might have folks using their own personal computer, their own personal mobile phone, their home phone. There might be many, many different aspects of this that we need to think about, from a damage standpoint, from a cost standpoint, from a security standpoint. So what is the company providing and paying for, and what is expected that the employee will be providing and paying for? And what are the rules of engagement around those? Marie mentioned some security and confidentiality. You know, depending on the nature of your business, you may have client files at home. You may have access to certain systems that isn't through a VPN or a secure environment. So what do employees have at home? What kind of access or protection are they required to maintain? Do they have to have a locked file folder? And then something that's not talked about a lot, but is actually, you know, quite important, is what other devices are listening. If someone has an Alexa in their home and they're talking to a client or a patient about their confidential information, we need to consider whether those devices need to be turned off. So that's a really important one that most people don't really think about. And then I think remembering that this is all new. Some employees are comfortable with it on a temporary basis. Some are not comfortable with it at all. But we need to have some patience and grace in implementing these policies. Without question, it's in your best interest as a business to have a formal written policy that you communicate out to folks. But it needs to be well thought out, and it needs to have some flexibility with what is the long-term structure that the organization needs to address all of these risks and issues. But then also, what is the reality of today? The reality of today includes, you know, kids at home all the time, spouses at home all the time. There's a whole new dynamic around what we're dealing with, and regardless of what your long-term structure looks like, today's might be a little different, and you need to build in a little bit of that flexibility into that process.
One minute to spare. I don't know if Joe, if you had any final thoughts for us as we wrap up today.
Absolutely, I do. As you can see me for some reason in the bottom corner of my screen. I appreciate the information that you've shared today. A lot of it very technical in nature, but then again, that's what folks are dealing with. I wanted to ask a quick question, Michelle, before we break away, and that is, this is an unprecedented time. This is something that we haven't faced before. Is there any sense that policymakers will look at liability shields or any kind of leniency in the adjudication of some of the most likely to occur lawsuits or OSHA enforcements or regulatory things? What's your sense about leniency in this brave new world?
You know, I don't know that I can speak specifically to whether there has been any discussion of it. I think employers need to really take an employee-centric approach to this. So looking at what your employee needs and doing everything you can to support them right now and in the foreseeable future, I think is the best approach. And then if there's leniency, then so be it. That's a nice grace that we would have.
That's a great way to look at it. Well, I want to thank all of our presenters here today. This was really an extraordinary opportunity here from some experts in issues that we at the Chamber have been getting a lot of phone calls about, and they've obviously know their stuff, and they've also offered to answer some of your questions offline as well. So we'd encourage folks to visit us online at bellevuechamber.org and to provide any questions that you might have to us there. And also we're manning a call center through the Chamber to help businesses connect with specific resources, whether they be the financial resources that folks need or the resources that we've talked about here today in terms of professional help in these strange times. We've also got more webinars coming up next week, especially those focused on healthcare and business resources. So we hope you'll tune in there. Thanks again so much to our great presenters, and we look forward to seeing you next week.
Thank you so much.
Thank you.
Thanks.